Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr. Mohammad Rauf, Assistant Professor, Faculty of Sharia and Law, Maldives National University, Republic Maldives. My today's presentation is Issues and Impact of COVID-19 on Socio-Legal Aspects of Human Life, a case study of Greater Malay region in Maldives. Coronavirus infection, referred to as the COVID-19, is a global pandemic caused by the SARS-CoV-2 virus, which has resulted in cessation of the daily normal life worldwide. This current global pandemic breaks out has posed a very serious social legal challenges to the entire world, including Maldives. The COVID-19 pandemic and the associated social legal crisis have raised many unforeseen, imposing, wrenching trade. The Greater Malay region, commonly we call GMLR, was found as the worst affected for being the center of power and socio-legal activities. Thus, a little spark of coronavirus infection was supposed to make this city stand on her heels and in turn the whole country. Thus, it becomes important to understand the socio-legal, health and economic impact posed by the pandemic and the measures taken to avoid it. Also, it is significant to know the compliance mechanism which gear to battle against the crisis, its adverse and pleasant impact. The conceptual background of the study: the complete lockdown in the Maldives was implemented through executive orders beginning 17th April 2020, together with guidelines under the Public Health Emergency Order. Only essential services such as those related to the security, government, food, medical supplies and municipal cleaning were permitted to continue operations, and by sometime in the curtailed manner. Objective of the study to look for the possible social, legal and economic impact of the pandemic upon the lives of the study area, to examine the physical and mental effect upon the people's health during the lockdown period, and to identify possible areas which may provide long-term solutions to such problems to tackle if any arises. On the basis of the research question, I have something in mind. Why there were legal and economic challenges that arise, although the focus was on the public health. What are the reasons behind the rise of domestic violence and petty crime? How the law enforcing agency should respond in order to face the challenges as well as to maintain the sanctity of the steps taken to deal with the public health. The significance of the study, this study or the research paper has a topic which has a high significance due to its proximity with the current situation. The challenges posed by the COVID-19 pandemic require an extensive research to do smoothly, and this paper is one in many such researches. The significance of this study is to answer those questions which impacted the socio-legal aspect of human life by creating problem in the proper implementation of the results and regulation in order to combat COVID-19 and long-term solution upon the socio-legal impact of COVID-19 in Maldives. The scope of the study, even since this issue came into light, the government authorities, NGOs and other stakeholders have been able to find an effective and long-term solution to this problem. The health and treatment procedures laid out in current medical and related law of Maldives are simply, especially if it is huge crisis as COVID-19, despite the growing concerns with regard to deal with the pandemic like COVID-19 in the Maldives. The making, executing and adjudicating bodies seem to be largely confused on taking this issue on the administrative level. The following, or on the basis of that, there are some specific considerations. The loophole in the current social-legal arrangement, the process of the treatment and dealing with the pandemic in current system, both on legal ground and administrative measures to prevent such crisis in future. How the current available laws have a positive impact on the expectation of the needy residents of GMLR. So why the GMLR as a study area, a question in your mind? The area selected for the study is a greater Malay region, in short GMLR. The GMLR comprising Malay cities, Macchangodi, Hambari, Gadelu, Manpanu, Viligiri and Hormale region. GMLR is one of the most densely populated area not only in Maldives but of the world. In GMLR, Malé is the oldest and highly populated city. Hormale is an artificially reclaimed island, and Viligiri is completely small yet another important island. All these areas are basically the residential place along with the business, education, political and corporate activities. The second point, social, legal and economic aspect of human life in the study area. There are a lot of social, legal aspects of human life which make the GMLR potential research area, of which are few important ones. Number one, huge population in a less space affecting families, economic progress more than other islands, migration from the island, modernization, more job opportunities exposed to the outer world, strong consumerism, variety of choice, expensive lifestyle, lack of community feel. Source of the information, sample size and the sampling procedure. The research sample size and sampling procedure is the conceptual structure upon which the research is conducted. The questionnaire was responded by 95 respondents consisting both local residents and experts in the study area, which were divided into three sections: social, legal and health. The questionnaire consisting 25 questions based on 5-point scale. The questionnaire was sent through the internet primarily as Google form link on the random sampling method. Results and discussion. The COVID-19 crisis is a crucial reminder of the importance of ensuring lasting progress with respect to social rights enjoyment, particularly through the development of the universal public health service. It is crucial that the Constitution of the Republic of Maldives has been made in such a manner as to be efficiently used to shape human rights complaint responses to the crisis of which COVID-19 pandemic is just of a kind, and to take stock once the crisis is over. The legal compliance mechanisms are excellent tool for reconstruction effect will follow, provided the scholars and the legal professionals must go hand in hand. There are many such examples ranging from the health institution to the law execution process. The hospital and private clinic have been found confusing only on the COVID-19 patient, which in turn is creating problem for the patient of the other disease. In practice, private clinics have not been admitted or non-COVID emergency patients. It appears as if the establishment has forgotten that we are used in order as well as which too can be fatal as COVID-19, or even more than that. There is confusion among the people regarding the availability of the arrangement and the other necessary medical facilities that used to be in clinic for every other kind of disease, now being used solely for the treatment of COVID-19 patients. The chart shows you the strongly agree, neither agree nor disagree, and strongly agree, and that the 48% shows that. In the second point, chances of getting infection with COVID-19 moving in public place, see which. So neither agree nor agree is 29.7%, whereas the agree is 29.7%. Changing in the social and human behavior due to lockdown, strongly agree 39.2% and agree 42.9%. Near about more than 50% is agree on that basis. It is an important thing for us. Increasing in domestic violence due to the lockdown rule, 32% is agree and 21% is strongly agree. It means on the basis of the data available, you can say in COVID-19 crisis, domestic violence. On that, the overall, there are other issues also there regarding the changing social life and other things. Due to the shortage of the time, I am unable to conclude my paper in within time. So, on the basis of the conclusion, the COVID-19 pandemic has left behind a trail of untold stories of human suffering, although the policymaker and the stakeholder tried their level best to the cope up with the amount of socio-legal damages in the best possible way. While the legal instruments were made effective more than before, the monitoring mechanism was made more stringent than the expectation, yet the negativity of the crisis made the resident of the GMLR suffer to their wildest dreams. It may be from in the sincere research language that the loopholes weren't addressed either in satisfactory manner or in the real time period. As the situation could have been not this much grim, newspapers just try to find out those grey areas of socio-legal issues that may leave a lasting impression of the social advertising. Thus, the research aims to help policymakers, leaders, and the public better understand how to manage truth, navigate different social and cultural contexts, improve scientific communication, align individual and collective interests, employ effective leadership, and provide social and emotional support with the outcome of this. Thank you very much. My email Mohammad Rauf at the rate of